this third Sustainable Healthcare Forum. I'd like to express my thanks to Ngāhi Nui Rhys-Jones for your mihi on the website, and to David Pension, who sadly can't be with us, for his opening to set this fortnightly webinar series into a broader context. This is our third forum. It's an unusual set of circumstances this time, but perhaps a good reminder of the precarious nature of our life here and the way we have chosen to live our lives on this planet. And so perhaps it's a very appropriate thing that we're conducting this forum by Zoom. The COVID-19 pandemic has exposed the vulnerabilities of many aspects of how we live across societies all over the world, and has perhaps highlighted too that we have been dancing around the edges of an even bigger problem that's going to affect even more of us, climate change. And that's why the work that we all do is so important. And I want to thank each and every one of you here on this webinar for attending this. And in particular, I want to thank our guest this afternoon, the Honourable Julie Anne Genter, the Minister for Women, Associate Minister for Health and for Transport, for her support for us over the last few years. I know that without her support, we would not be where we are today. We would like to be a lot further on, but I know that she has given us her 100% support from that very moment that she opened our first forum in 2017, in November 2017. And the day that she got her delegation as the Associate Minister for Health, including climate change, which was a wonderful thing for us. So I want to thank you, Minister Genter, for everything that you've done for our group and for the work that you've done more generally in your portfolios, and welcome you to open our webinar series this afternoon. Thanks so much.
Tēnā koutou, tēnā koutou, tēnā tātou katoa, ngā mihi nui kia koutou. Thank you so much for that introduction, David, and for all the work that you do championing sustainability in the health system and in life generally. It's fantastic. It's a pleasure to be here today to open this series of webinars, and I want to acknowledge all of the effort that has gone in across the health sector, both over the last few years in progressing this agenda of sustainable health and wellness, and over the last few months in the response to COVID-19. I think that we've achieved a phenomenal outcome. And as David said, the global pandemic really does show us how vulnerable and interconnected our human societies are around the world. And on a more positive note, I think that our response here in New Zealand demonstrates that we absolutely can achieve amazing things when we all work together in order to protect the health and well-being of our fellow humans. I'd like to acknowledge the organizing committee for this event, the sustainability managers from the DHBs, and all of the staff who've worked so hard and given up their own free time to do this work, because often it hasn't been, it's been something that they've done out of the passion for it, not because they're paid to do it. Our response to the COVID-19 pandemic has meant that we had to make some very significant changes. And the resilience of the health sector and the ability to adapt and respond to this crisis is to be commended. In and out of the health sector, we've had to change the way we do things overnight. And the crisis has highlighted that the work on sustainability and the response to climate change is more important than ever. The DHBs have, like many other large organizational systems, been agile and responsive by enabling thousands of employees that were not required on the hospital site to work from home. Patients have had access to virtual appointments, and the streets have never been more inviting or safe for pedestrians and cyclists, at least not in this century. So, you know, while it's been terrible that there's been such a loss of life globally, and even the, 22 people that we lost to COVID-19 here in New Zealand, and the health impacts have been non-negligible, that period of shutdown also opened up a window in which we could see the potential for our towns and cities to work differently, where families were getting out on the streets, walking and cycling for the first time in ages, where people were spending a little bit more time in their communities and more time with their families. And there are challenges associated with that, like, you know, people who live in a dangerous family situation, people who lost their incomes due to loss of jobs during this. But those are things that we can manage and work on together. And this has demonstrated that when we have a collective goal that we all agree on, if we work together, we can achieve it. And that, I think, is absolutely the role of government, is to help support this collective project we have to improve people's health and well-being. And in order to do that, we have to look after our environment. This is where we live. This is our home. We need clean air, clean water, a stable climate. We need regenerative agriculture that's producing nourishing food and can for generations to come. So I can tell you a little bit about the work that the government has been doing over the past 2 years on climate change and health and where we've got to. I think there are a couple of really good developments, and I completely understand people would like to see us go further and faster. And as a member of the Green Party caucus, I certainly agree with that desire to go further and faster on sustainability. We, for the first time, put into letters of expectations to district health boards and to Pharmac some requirements to think about climate change, reducing emissions. And so that work started to happen at that highest level in the district health boards and in Pharmac, that sustainability had to be taken into account. We used this fantastic network, but we also tried to formalize some support in the Ministry of Health for there to be a network of people across DHBs who could focus on best practice. And we did a bit of a stock take to see what was already being done, and let's benchmark that and try to share knowledge across DHBs so that everybody can lift their game. Most recently, the Prime Minister wrote a letter to all district health boards and indeed all government departments and set out her expectations around electric vehicles and made it very, very clear that the expectation is anytime a vehicle is replaced, it should be electric wherever possible. And this will help ensure that we have that transition of our light vehicle fleet to zero emissions fleet. We released a report that kind of summarized some of the best practice, and I know that some DHBs are really leading the way in different areas. Many DHBs are already using CMARS or another tool to measure their greenhouse gas emissions, and I would like to see this right across the sector, and I believe that work is being done on that. I'll just do a shout out to some of the innovative schemes that have come out of DHBs. For example, I know that in Nelson, they've had a very successful trial of Meatfree Mondays, and in fact got really positive results from that. And of course, we launched in conjunction with the Director General of Health a program across government. So it's not limited to the health sector, but certainly some district health boards and the Ministry of Health were involved in our program of discounted electric bicycles for public service employees. And I hope that more district health boards will be participating in that scheme, which just makes it easy for staff to get to trial and to choose an electric bike and even to get finance for it, so that they don't have to pay anything up front. And that will help with a more sustainable and healthy commute. So those are some of the things we've done. And I almost forgot, one of the most important things is the Ministry of Health is now developing guidelines and standards around all of the different capital investments that are being made in buildings. So we announced that the Taranaki hospital rebuild and Dunedin are both looking at Green Star. I understand that Green Star is the recommended tool for those large scale builds, and that the ministry is working on developing guidance and advice to make sure that there is a best practice, systematic approach to how Green Star is used. I'm also aware that they're looking at neighbors for retrofits of existing places that aren't a big new rebuild, but to help benchmark and measure the environmental impact of what's happening there. And for the smaller scale projects, there'll be a life cycle analysis with energy modeling as scalable. That's like a way to ensure that we're taking into account the whole of life costs and environmental impact in those capital investments. So the Ministry of Health's new Health Infrastructure Unit is progressing this work and is working with a sustainability collective, which involves architects and other people who are passionate about this issue, to ensure that we have the best practice tools and guidance to ensure that those environmental outcomes are central to the decisions that are being made and aren't value managed out of the process. Of course, with the Zero Carbon Act being passed, there's going to be the development of budgets right across government, and we would expect healthcare to be involved in that. So the Climate Commission's been set up, and so we're building that longer term infrastructure that will help ensure that right across our public service, including our health sector, that we're taking the steps that we need to reduce emissions. And as well as to address some of our broader social goals. It's entirely possible for us to pursue sustainability, reducing greenhouse gas emissions, reducing waste and pollution, and to increase equity in our communities, to involve Māori, to target the most at-risk communities who are suffering from some of the worst socioeconomic outcomes, and they will be the ones who are most disadvantaged from our environmental crises. So by focusing on both of those things as a government, I do believe that we will create a sustainable and fair Aotearoa, but not without all of your help. Your work is essential in underpinning everything that we're doing. So I thank you for that. And I think I should probably spend some time answering questions.
Thank you very much, Minister. It's lovely to hear that summary of work. And I think that many in the audience will recognize their own contributions in helping getting some of that work onto the radar and up and running. And it's a really good reward for a lot of hard work. There are a number of questions that have come through. I want to raise one initially that comes in relationship to something you've already mentioned around the establishment of the Climate Change Commission and the passing of the Zero Carbon Bill, and the concern from the writer that there's been little time given to the healthcare issues that relate to that, so it's not really been mentioned at any stage yet. So how might that work? Do you have a sense of that yet?
I think that's something that should be considered by the Climate Change Commission. I know there were some questions about could we have had someone on the commission itself, a commissioner or on the board who had a specific health background. I think that the minister was trying to balance a whole lot of different needs for scientific competence and particular experience in economics and those sectors that are most responsible for producing our greenhouse pollution, as well as, of course, a diversity of people, Māori, and other diverse backgrounds. So I think it was probably just a question of how do we get that many different competing areas of expertise into one commission that's looking across the whole thing, and probably the agriculture and transport and energy are the three kind of biggest ones. It doesn't mean that the health system isn't important. It is responsible for somewhere between 3 and 8% of our emissions. But I think that it is entirely, I do believe the commission will provide guidance and budgets and the sorts of KPIs that will drive efficiency and improvements in the health sector as well.
What do you think that we could do to ensure that we don't languish in that whole process? Are there things that you would suggest to us?
I think maybe you should write to the commission if you haven't already and be in contact with them so they know that you exist and offer that make sure that you make contact with someone developing work there so that you can be a resource that they call upon and that they don't fight of health.
Okay, cool. That's very good. Thank you very much for that. There's a number of questions here. I'll just go through them. This is a bit of a tricky one. I don't know if you'll be able to answer it. Which health projects have received funds to date from the State Sector Decarbonisation Fund? Do you know, and how much is left in that fund? And how did DHBs apply for funds for so-called shovel-ready, not such a great term, but shovel-ready projects? Could you help us with that?
Yeah, sure. I can't tell you exactly how much is left. I know there was a couple $100 million signaled for state sector decarbonization, and some of that was for hospital projects, and mostly it's energy transition heating. So Ashburton's aging coal-fired boilers are set to be replaced with a huge ground source heat pumps, which take heat from the water in underground aquifers and return clean, if slightly cooler, water to the ground. And heat pumps are a feasible option for Ashburton because of their heating infrastructure. So they already had valve pipes, radiators, and so it was more easily converted from steam to hot water. Hillmorton Hospital's heating will be upgraded from LPG to woody biomass fueled heating, and the additional planned new facilities will help achieve a higher Green Star rating. I know of those two specific projects, and I believe that there's more, but I don't know if all of it's been allocated or not. But I could try to request that information from the ministry and provide it to you.
Okay.
Shovel-ready. I think the shovel-ready projects, that ship has sailed. Like 1,800 projects that were put forward shovel-ready. Obviously, I personally want to see a climate lens applied to all of them. But yeah, I think that there will be, if you have a specific decarbonization project, get in touch with ECA. They still have some money available. Okay,
all right. Just can I ask you a question just about the sort of the level of visibility of the intersection between carbon reduction and health co-benefit within the government? Do you think that that's reasonably well understood? And when I ask that question, I ask about particularly thinking about some of those big infrastructure projects like cycle lanes. I also ask that question in the context of, the health report and, inequity and the obesity epidemic and things like that. So do you think there's an understanding of the sort of the syndemic, these are in fact have common causes and common solutions, both of these big issues?
Outside of this network, and some people are really passionate about sustainable transport, I don't think it's really widely understood. I think that's something that we can all work on and continue making that connection for people and trying to get it into like media, public information campaigns so that people better understand that. I've certainly tried to use healthy, happy, green every time to describe cities to make that connection, but I think it does take time, and people, it might not be intuitive to people that because they're so used to both of those problems being framed as individual problems and not system problems. So that if you brought up that obesity was related to transport infrastructure, inactivity, and the food environment and poverty, that wouldn't necessarily be obvious to people.
Okay. There's another question here. It's an interesting question. It's come from one of the viewers. And the viewer asks really around climate breakdown. And I suppose it's sort of coming at this from the best sense of what the future might hold is what's happened in the past. And that, we've struggled to meet the targets that we've set ourselves for decades when it comes to global warming and carbon reduction. So the question really relates to what preparation the ministry and the district health boards are making for climate breakdown. And I suppose that's a kind of adaptation question, really, ensuring that there's adequate air conditioning and coping with heat waves and the mental health consequences of climate change and those kinds of sort of flow-on effects that we've talked about and we know are likely to happen, and some of which we've actually seen modeled during the COVID pandemic. So the question really relates to that adaptation to the climate breakdown.
Yeah, to be honest, I haven't seen a lot of work done on climate breakdown and that adaptation piece, and I think that is work that does need to be done. And I'm sure that, you know, a lot of resource had to be redirected to deal with COVID-19, and I think that we'll have to continue to build the capacity in the public sector and probably in the private sector to understand what is needed for us to adapt, what is likely to happen, and, you know, how we can prepare and be resilient to that. So I think it's something that we do need to do, and, you know, that adaptation was something that was certainly considered in the setup of the Climate Commission, and we are going to need more public resources dedicated to this to be able to prepare adequately.
I don't know whether you've had a chance to look much at the Heather Simpson report today. You've probably been quite busy. All of us have been a bit. But it's quite interesting because the report, in a way, shifts us from what I think many of us have seen as a fragmented system based around targets and compliance to a more aligned and coordinated system with shared values and a common culture. There's no mention, of course, of sustainability in the report, and in a funny sort of a way, you know, I didn't really expect there was going to be. But do you see this as an opportunity to really embed the kinds of culture that we're trying to breed in the individual DHBs that many of us have been working hard to do? As a result of this new report, there's opportunity there.
Yeah, I definitely think the report lays out an opportunity in reimagining the structures that are delivering the services that we need and making sure they're more in the community and more integrated, that we're going to have to put sustainability at the heart of everything we do. And yeah, certainly I would like to see that embedded from the beginning. So it will depend on, you know, the next government is going to be overseeing the transition, having a voice that's very focused on sustainability in government is going to be really crucial, because otherwise I think it could get left out. But I'm sure that this network will continue to raise it and bring it to the fore.
Yeah, I'm sure we will. There's a lot of work going on in communities to try and improve their own well-being. And some of that work is related to some district health board efforts, and some of it is independent. And some of the work relates to the issue of regenerative sort of growing practices, particularly around nutritious food, and trying to provide alternatives to fast foods that are so ingrained in many parts of the country, particularly the poorer parts of the country, where obesity and its complications are serious problems. Just speaking as a member of the Green Party, do you have a policy with respect to the comprehensive prevention of harm from unhealthy food, or would you be willing to entertain that through a process of regulation, social marketing, and individual behaviour change? Would that be something that the Green Party would support?
Oh, well, the Green Party is very supportive of using regulation and other tools to reduce the harm to the community that is caused by junk food advertising. And we are very supportive of a sugary drinks tax as the first logical place to go, because that has the most evidence behind it. And I think you will see in the running up to the election a regenerative approach to agriculture. We have to be a sustainable food producer in New Zealand. We can't afford to keep trashing our waterways and our soil. And there's a huge opportunity to create meaningful work and meaningful lives for people by taking an approach that protects people's health and the planet's health and puts that front and center.
One of the participants has pointed out to me that, in fact, it is mentioned on page 236 of the report. So that's kind of good, and I'll certainly look that up. So thank you to that person who did that. The issue of cross-government approach to reduce carbon has been one that we've talked about for quite some time, and you know, for many of us who are members of the SBN and the Climate Leaders Coalition and other groups, or even Toitū now, the majority of members of those organisations are corporates, small medium enterprises. Very few public service organisations seem to belong to those organisations. I think the Ministry for the Environment have joined about 18 months ago, I think, what was then the CMAR scheme, now the Toitū carbon reduction scheme. Is there any move from the State Services Commission or across the public service to embrace carbon reduction at their own individual operating levels?
I can't speak for the entire public service, but that is something that we've been raising, and we certainly raised it a lot with the Ministry of Health to say, hey, and beyond, to say, wouldn't it be great if across government we were working together on a standard approach to make sure that we were measuring and reducing our climate pollution. But I'd have to go away and find out what's happened to that.
It would be good to understand that, because I think that maybe there are things that we could do to assist in that regard through our own advocacy.
Somebody in the chat said Toitū now has over 45 public sectors organizations working with them, joining. So that's good.
Yeah, that's very good. That's very good. Just to, maybe just to carry on with maybe it's our final question, and it relates to capital investment, and we're very thrilled about the move by the Ministry of Health to incorporate people from the design and engineering and health areas to look at infrastructure and new capital investment, and how we might refurb older buildings and manage energy much more efficiently in smaller builds. My question, I suppose, arises is, would you see that this work might well be transferable to other areas of capital investment across the public sector as well? And I know that we have similar issues in education and other areas too. So might this spread?
Yeah, I think obviously hospitals are kind of a unique type of building, and in a way that makes it even a little bit harder. But certainly in state housing, Aotearoa has committed to minimum Green Star level 6. I think that extends beyond just state housing as well, like to some of the Kiwi build houses. And I know the Ministry of Education, there was a group of ministers who had a conversation, and we said we shouldn't be reinventing the wheel when it comes to procurement and infrastructure. There's broad support across government, across the parties and ministers for that.
Was really interesting for us at Counties Manukau. Our chair is Rui Markoshi, who is in fact the chair of Kāinga Ora. And he has been with us on a number of visits to look at the way that food waste can be recycled into compost, and that compost recycled into gardens for growing nutritious food, vegetables in particular. And he's accompanied us on a number of visits to the Wiri Men's Prison here in South Auckland, where that happens. And it's a prison of 900 people, and they grow 50% of their own vegetables on site. And in fact, supplied hordes of people to Tupuia Marae in the run up to the 2017 election during the housing crisis at that time. And he's kind of spoken to us about the sort of the aspect of how a new housing developments, whether that be Aotearoa or private developers, the opportunity to create this kind of space that where communities can be built around this kind of activity. It's something that I think that we'd like to talk more to the government about, support for these kinds of initiatives in the public sector too, but I think that actually when it comes to housing developments, the same opportunity arises, I think. So that's something we'll bring up with you perhaps at some point.
Yeah, and that's something I'd like to get my teeth into, definitely. I know that some work has occurred, and Andrew Eagles has put in the chat that the Green Star 6 extends to all housing, state and private sector homes that Aotearoa are building. But yeah, definitely.
Cool.
I would like to even go beyond just the Green Star for the buildings, and what can we do around integrated, complete neighborhood design with cycleways and public transport and space. Yeah,
good. Well, we would love some of that down here in South Auckland, I have to say. You know, all that money spent on Franklin Road and Central Auckland, it makes me think, ooh. But anyway, listen, we're really out of time now. We're just after 16:30, so
I think I've got a meeting.
Well, I'm just going to thank you before you run off. So you can't run off till I thank you. But thank you, Minister Genter, for coming today to open this webinar series. The next one will be in 2 weeks. I'd also like to thank everyone who's come and participated and sent in questions, and very much like to thank our supporters from the University of Otago, Inga and Faith, who have really helped pull this together in the organising committee, Debbie and Marguerite and Matt and Victoria and others. So on that note, thank you very much. Have a good evening, and we'll see you soon. Okay, cool.